I have the honor and privilege to officially open the second part of our pre-convention. My name is Manuel and I am privileged and truly honored to introduce our distinguished keynote speaker in today's momentous occasion. He himself is a public servant, having served the Philippine government for 17 years, starting as a community physician in rural Mindanao, later becoming an infectious disease epidemiologist and a public health specialist. He rose through the ranks and was appointed Department of Health Secretary from 2001 to 2005, wherein he is remembered for his unprecedented achievements in disease control, such as in SARS, TB, measles, vaccine-derived polio. He is also remembered for his achievements in improved healthcare delivery that led to low-priced medicines and a widened PhilHealth coverage. He then served as director of the Department of Human Resources for Health at the World Health Organization in Geneva from 2005 to 2012, where he led technical and policy work on global health workforce issues. And this led to the adoption of the WHO Code for the international recruitment of health personnel by the World Health Assembly in 2010. Our speaker was awarded Outstanding Young Scientist of the National Academy of Science and Technology, Outstanding Alumnus for Health of the UP Alumni Association, and is an appointed Fellow of the London School of Hygiene and Tropical Medicine. Currently, he is the Dean of the Ateneo School of Medicine and Public Health. Friends and colleagues, let's all give a warm welcome to Dr. Manuel and Dayrit.
Good morning, everyone. Thank you very much for this opportunity to give the keynote address. First of all, may I acknowledge Dr. Clave Ramos, one of our honoree. I'd like to acknowledge any of the family and friends of Thelma Tupasi who are here. Of course, officials of PCP. I have to mention Charles Yu, Jeff Sui, and of course my former colleagues from the Department of Health, former Undersecretary Mirna Kubatahe, and longtime TB worker Marl Magdala, and of course to thank Mamel Calapio for this opportunity. Actually, when Mamel asked me to keynote this tribute to Thelma, I immediately said yes. I hadn't seen Thelma for many years, but I felt it was an honor to speak about a former boss. She was my boss at RITM, and a colleague whom I have admired for her scientific work and its impact on our people. Of course, her determination and her resilience. And I'm going to speak a little bit about that in this tribute. Pardon the cliche, we live in a very complex world, which is changing at a velocity very few of us can comfortably keep up with. For example, I for one avoid Facebook for various reasons. I still take notes on pen and paper and not on a tablet. The health sector and the practice of healthcare is changing too. And I wonder how many of you here came of age in the 1990s and 2000. Can I see you raise your hands if you graduated from medicine in 1990 or 2000? If you graduated before then, then maybe you're wiser and have more experience. Certainly the drive towards universal healthcare is forcing us to reinvent new ways of providing and financing healthcare. I don't know if you realize how much impact the universal healthcare law is going to have. We are being challenged to integrate our approaches, and we have a highly segmented system. Some people use the term fragmented. We have to bring down costs of healthcare. We have to increase quality. We have to achieve better outcomes for patients and populations. But actually, we've made so much scientific progress. I came of age in the 1970s, at the time when there were not enough TB diagnostics. So if you came of age in the 90s and 2000, you now have expert ultra. At the time, basically what we had was sputum microscopy. And I can tell you that I have been around long enough that I actually even got to know the people who were developing expert. People like Giorgio Rossino, Fine Diagnostics, and so on and so forth. And I had the chance to work with Dr. Mita Pardo-Tuduvera, who was a TB expert in the 1950s and 60s and dedicated her life there. So this tribute to Thelma Tupasi. When I think of Thelma, her work and her influence has spanned over 50 years. That's half a century. And Thelma should be held up as a model for young health professionals wanting to make a contribution to healthcare in this country and to the world. She came of age in the 1960s after she graduated from medicine. And through her life and career, she has set an example as physician, scientist, health leader, and I would say Filipino patriot. And she was a mentor to many of us who are in this room. Her career flowered at the time when controlling diseases was the paradigm. In the 1950s and 60s, the paradigm for delivering healthcare was vertical programs. Programs against malaria in the 1950s, in the 1960s, programs against schistosomiasis, programs against TB. That was essentially the paradigm. That paradigm is actually changing quite imperceptibly, particularly with the advent of universal health care. But that is another story, because this is the story of vertical and horizontal, and the challenge of increasing the effectiveness of primary care. I would say that Thelma, for the long time that I knew her, was a force of nature in medicine, particularly for TB control. And she used her expertise in this area to influence the policy and operations of the National TB Program. And it is for this reason that I think it was in 2013 that she was awarded to be an honorary member of the union, the International Union Against Tuberculosis, which is, you might say, the primary organization of TB control worldwide. And she was honored as one of the pillars of TB control by Coalition, which is the PhilCat, the Coalition of Public and Private Organizations for TB control. The previous speakers have alluded to the importance of the private sector in TB control, and that is very true. You see, I was in the Department of Health as early as the 1980s. And at that time, TB control was actually a mess. The public sector were not talking to the private sector. Those of you who are neurologists and you think of left brain and right brain. It's as if the corpus callosum had been cut between the left hemisphere and the right hemisphere. And therefore there was no communication, and they were working at cross purposes. But PhilCat actually changed that, so that eventually TB control in this country became far, far more coordinated and far, far more effective. We still have a TB problem, but I would say that TB control, by and large, is far, far better in this country than it was in the 1980s. Thelma exerted her influence from within the private sector and extended that influence to the national program of the Department of Health. She was strong-willed, passionate about improving health for Filipinos. What I admired about her was she was undaunted in the face of meager funds. She raised funds from various sources locally, and I'll tell you some about her fundraising activities. And internationally. For example, the WHO Green Light Committee. I was there in some of the meetings of the Green Light Committee when I was Secretary of Health. And the Global Fund to fight against HIV, TB, and malaria. And of course, for 30 years, she led the Tropical Disease Foundation, which was the principal recipient for funds of the Global Fund to fight TB, AIDS, and malaria. So let me tell you a little bit more detail about her story. And I'll pick up from the days when she was working as the director of RITM. She had actually joined RITM in 1981 and was heading the lab. And by the time I joined it, she was already the director. And it was she that actually recruited me in 1984 to join her. If you can see her, this is Thelma, and we're actually collecting her specimens in Manila Bay. And this is she in one of the Christmas parties at RITM. This is interesting. This is Dr. Kaneko. He is the Japanese resident consultant of RITM, which was actually established by JICA with Japanese funding. And this is Thelma here with some Japanese guests. These pictures are courtesy of Manuel. And you can see this was a Christmas party. Who are they? That's me. And if you know, this is Dr. Feli Monson, who did a lot of work on HIV in this country and was president of the HIV Society. So, when Thelma recruited me in 1984, I had just come back from Mindanao, where I had worked for 8 years in the community. And in those years when I was working at the community level in the rural areas of Mindanao, mainly in Davao del Norte, I was also doing TB control. At the time, Mita Pardo Tuvera had gotten some funding from the Dutch. And so we were already doing DOTS in 1979. And this is me, working in the community at that time. This is my wife, Ellery. And see, we're training community health workers here to do sputum microscopy. And trying to teach them to, appreciate what the lungs sound like. But this is the environment in which we work. This was one of our health workers. He was a kaabag, was a member of the church group. This is where they lived. These are his children. This is one of our health workers. And so this was the environment that I had come from by the time I joined RITM. And I had come out from this environment when I knew you needed to do something about health delivery in this country if you were to improve it. And therefore, I came then to RITM. At that time, when I joined RITM, Thelma was already the director. And she was doing research on acute respiratory infections. And this is, well, one slide that I got just to represent her work there. She was looking at the etiologies of ARI. And you know, at that time, they were already trying to look at, you might say, decision trees or the type of simple diagnostics that would identify children who had pneumonia. And that's when they were looking at respiratory rates. And so Thelma at the time was getting funds from the US, Boston, for example, one of the bureaus of NIH, to do research on acute respiratory infections. Eventually, Thelma left RITM. But as an aside, one of the things that she actually conceived before she left was she conceptualized the founding of the Field Epidemiology Training Program. By the time, Thelma, because she was doing a lot of field research, particularly in ARI, wanted the infectious disease fellows of RITM to know more about epidemiology. And so she contacted her friends in USAID and in CDC. She had studied in the US, done fellowships there, and so she had contacts. And she said, I want this training program to come and be established in the country. And so we could train, you might say, physicians, and make them epidemiologists as well. So the people from CDC came, but eventually the decision was, if you wanted to set up a field epidemiology training program in the country, it needed to be based at the center of the Department of Health, because that was the nerve center for reporting of epidemics. And so that idea got born, but it changed in concept. And eventually, with Thelma leaving RITM and joining the private sector more or less on a permanent basis, I was left to carry the mantle of FETP. And this is just a picture of our trainees in 1989 and 1990. I don't know if you know some of them. Well, this is me. I don't know if you know Conchi Roses. Okay. This is Betsy Miranda, a big name now in rabies control, a veterinarian. She was one of our trainees. And this is Mark White, our resident advisor from CDC, and his wife, Betsy White, who unfortunately passed away. But I consider Thelma, you might say, the mother of FTP, even if she never eventually nurtured it after it was born. It was born in 1986, 1987, and in 2017, it celebrated its 30th year. And many of the epidemiologists in the Department of Health have trained in this program. So let me go further then and try to put Thelma's contributions as scientist and a health leader within the context of our macro situation. These are the Sustainable Development Goals, and number 3 is health. You can see that health is only one of all of the goals which need to actually all be addressed if we're going to change and improve healthcare and the life of our people. If we were to drill down from that, these are the specific targets or goals for number 3. And I put a star across 5 communicable diseases, because I would say that it is in this area that Thelma actually made her mark. And now we are in the season of universal health care, which means the goal of this country is to make every Filipino have access to quality and affordable healthcare. But if we were to look at it just from a disease perspective, you may be familiar with this. This is a diagram created by John Wong, Burden of Disease, where he looked at 48 disease causes which are responsible for 80% of our country's burden of disease. Number 1 here is ischemic heart disease. At the end there, number 48 is falls. And then in between, you have all of these different diseases. I put an arrow over here because this is where Thelma worked for most of her career. In lower respiratory infections, as I told you, she did work on pneumonias and their etiologies, and of course, tuberculosis, particularly the area of multiple drug resistance. And this has big implications because, according to John Wong's analysis, if this is the present ranking of our disease burden, lower respiratory infections, tuberculosis, in 2025, the ranking will not change. In 2035, the ranking will still not change. So you can see that the impact of our contributions in these areas really should be acknowledged. Fast forward to 2009. This is an article that Thelma wrote, Significant Decline in Tuberculosis Burden in the Philippines 10 years after initiating DOMS. I've just put that fast forward so that we can go back and look what happened before 2009. Some context. In 2001, and I just date that arbitrarily because that was the year that I was appointed Secretary of Health. The Philippines was one of the world's 21 high-burden countries. And I know that for a fact because as Secretary of Health, I would attend these WHO meetings of the high-burden countries. And those high-burden countries included India, Pakistan, Bangladesh, Nigeria, Indonesia, Philippines. So WHO figured that by controlling TB amongst these high-burden countries, they would show a global impact. What happened before 2001? And this is where I would say Thelma's story can be highlighted. Because in 1997, Thelma led the 1997 National Prevalence Survey for TB. And she did so also in 2007. I cannot underemphasize the importance of this prevalence survey. This was a massive undertaking. When I was working on TB in the late 70s, I would be reading all of these journals on TB. And I knew that really there was no way to estimate theoretically our burden of disease unless you did the survey. And the fact that Thelma led that 1997 survey and repeated in 2007 is something that's cause for celebration. This is how the survey was conducted, and therefore you could look at all of the different sites where they had to collect the data and eventually do the analysis. But as a result of that survey, Thelma found something, and this is the story of her life. She found that of 601 TB symptomatics who consulted, the majority of them actually consulted in private clinics. So the importance of the private sector in TB control. It was as a result of that eventually she found the niche and therefore declared, this is her slide, the private sector should assume equal responsibility in TB control as the public sector. And as a result of that, champion as she is, she then opened the Makati Medical Center DOTS Clinic in March 24, 1999. So leading the national survey in 1997, setting up the DOTS Clinic in 1999, and this is how it looked like. DOTS Clinic in the hospital, DOTS Clinic in the field. And I could relate to this because when I was working in Mindanao, we would go house to house to actually visit patients who were living in their homes. And TB had such a stigma that these patients wouldn't come out of their houses. So I could appreciate the importance of case finding in the households. And to organize the theory around the DOTS Clinic, these are the 5 elements of that clinic, which were the same principles that we actually adhered to when we were working in the field. The commitment, having sputum microscopy, short course chemotherapy, uninterrupted supply of drugs, and monitoring. A systemic approach to DP control. And an organized effort that needs to be there if we're going to succeed. Now, despite all of these best theories and intentions, the data showed cure of 80% from the Makati Med data, but it showed, and this is what I pointed out, failure in retreatment cases. This failure in retreatment cases then piqued, I think, Thelma's antennas. And as a result of that, harking back to the TB survey in 1997, quantifying the amount of MDR-TB, stating that management of MDR-TB outside the proper setting will only lead to further drug resistance, and setting the rationale that MDR-TB is a problem for the country because patients are left untreated, leading to more transmission, amplifying resistance, and so on and so forth. Voila. Makati Medical Center then, under Thelma, set up in late, I would say, 1999, the DOTS Plus clinic, which you might say was the pilot clinic, possibly worldwide, for MDR-TB control. And this slide just tells the story of Thelma's journey. When she set this up, there was no funding. She had to find the funding. She went to PCSO, she held concerts. Manuel says that in some of the concerts, they raised ₱1 million. That was just enough to treat 10 to 12 patients. Eventually, she was able to get funding from the Green Light Committee in 2001, and eventually from the Global Fund in 2003. And the rest of the slides will show that story. But when she set up the MDR-TB program, she didn't need to go far. At the back door of Makati Medical, Barangay Urban Botanical, she started her work. Along the relays, that's her, I guess, teaching health workers there and community leaders, raising funds, PCSO, the Makati Medical Dots Clinic, Dots Plus Clinic, had a cure rate of 67. That is for all patients that went into treatment. But for those that completed it, the cure rates were higher, and the data said that it was as high as 82%. And so eventually, as a result of her work, she applied to the Green Light Committee, was able to get funds in 2001. The Green Light Committee conducted a number of site visits. And this was the advantage. You see, WHO at the time already realized that this was going to be a problem. The chair of the Green Light Committee, a historical footnote, was, if you know him, Dr. Jim Kim. He became the advisor to J.W. Lee in WHO and eventually became the president of the World Bank. But Jim Kim was an internist and he was the chair of the Green Light Committee. And I think it was this committee that approved, and it was this committee, and I don't know if it was Jim who was still the chair, that approved Thelma's request in 2001. But you can see here all the reasons why it was good to get money from the Green Light Committee. And the Green Light Committee paid at least 6, maybe as many as 7 or 8 monitoring visits. This is one of the monitoring visits in 2005. In order to do this work, Thelma did the science. And I can't understand all of this. But it will just tell you the amount of work that she put in to study the resistance patterns of TB. And she also pushed the numbers to look at the cost effectiveness for MDR-TB control, so that eventually an analysis of DOTS Plus in the Philippines was made. And it said, DOTS Plus is good value for money in relation to standard benchmarks for low and middle income countries. DOTS Plus in the Philippines is highly cost effective. Eventually, in 2005, the Tropical Disease Foundation became the partner of the Global Fund, and they got enough money to treat 500 patients with second-line TB drugs, and even expand this to the country. And essentially, this is what happened. So this is Thelma witnessing the signing of Global Fund support. This is towards the last part of this talk now. And this is a slide that just shows you how from phase 1, a pilot project of DOTS Plus, eventually the program expanded to reach many parts of the country. It expanded in Metro Manila. It expanded in different areas, including Lung Center, Quezon Institute. It expanded in Region 4. Remember, this was in 2005, 2006, huh? I'm sorry. It expanded in Atimonan. And in a sense, DOTS and DOTS Plus became combined so that RHUs now could become DOTS Plus centers. Now, I don't know how successful this has been, but this really has to do with organizing your healthcare. Okay, but you must remember that when this was being worked out, all of this had to be studied in terms of their efficiencies and effectiveness. This is just a slide of Lynn Johnson, which I was able to get from Manuel, and she presented in 2006 from a DOTS center. You have a DOTS Plus. eventually an expansion to different areas. And you can see that expanding. But the slide of Dr. Ama earlier, where you saw the network of laboratories, in a sense, already tells us how this network has expanded through the years. So this is Thelma in 2007 at an IUAT conference in Cape Town. She was now a global leader in MDR-TB and of course in TB control. And in 2009, this is a slide of one of the launchings of the programmatic management of drug-resistant TB of the Department of Health in Davao City. So this is Thelma as a private sector scientist and physician influencing the growth of the national TB program. So I will put this slide here because this is an article that she wrote in 2014. And it was in 2016, not very long ago, which tells us the expanse of her contributions. From the time that she graduated in the mid-60s, her work at RITM, her work in the Tropical Disease Foundation. Thelma has many contributions to healthcare, but she will probably be best known for her work on MDR-TB. She leaves a legacy for many to follow. She worked on many fronts, clinical and scientific, fundraising to support those efforts. She worked at the community level, she worked at the level of the national program, and she worked at the level of global health. She was chair of the Stop TB's working group for drug-resistant TB and a core member of the Stop TB working group. She trained many fellows, residents in internal medicine. She trained many doctors and nurses and medtechs. She set up an innovative approach to TB control, including forging partnerships, mobilizing resources, and she even promoted the livelihood of patients. She published a book on TB patients and health worker stories. Thelma is a true example of a scientist, a health leader, and a patriot. I will conclude my remarks by paying my own personal tribute to her, by recalling some of the things that struck me about her. In 1991 or 1992, one of Thelma's classmates who was practicing in the US, and she was a psychiatrist, and I think she was involved in treating many patients with opioids and regulated drugs. Her classmate, was charged with drug trafficking, and she needed legal fees to defend herself. And Thelma organized a concert here in the Philippines to raise money for her classmate in the US to pay her legal fees. I know that for a fact because I was one of the persons that she was able to persuade to play in that concert. I played one piano piece, and that was in 1991, 1992. But how many classmates would do that for a fellow classmate? To organize fundraising to pay legal fees. When I got sick of severe hepatitis in 1987, Thelma was the person I consulted in Makati Medical. And I remember that moment very, very well. Because my hepatitis A was cholestatic. I was greenish. And it was she looked at me and said, kawawa ka naman. You have cholestatic hepatitis A. And of course, eventually, when my father became seriously ill in 2007, interestingly, they couldn't find anything positive in his laboratory tests, except for one. They found fragments of TB bacillus in his bone marrow when they were looking for cancer. And it was Thelma that I called in to consult. But anyway, I remember Thelma very fondly for, the work that we actually were able to do together. But for the sake of this tribute, I think the country needs to remember her for her contributions to disease control, particularly on pneumonia and on tuberculosis, and most especially for multiple drug-resistant TB. So, in behalf of her friends, her colleagues, in behalf of the family, and in behalf of the country, let's thank Thelma Tupasi for her legacy to Philippine healthcare. Thank you.
Dr. Dayrit, please accept both my personal thanks and the thanks of the countless, many of whom are in the audience right now, whose lives Dr. Tupasi has touched, has influenced, has molded, has shaped. Thank you so much. Please be seated. I'd like to hand over to you this certificate of appreciation from the Philippine Society of Microbiology and Infectious Diseases. In grateful appreciation for your invaluable contribution as keynote speaker in this pre-convention entitled 2019 Updates on the Prevention, Diagnosis, and Management of Tuberculosis during PCP's 49th Annual Convention, 5 to 8 May 2019. Signed, Dr. Edgardo Faustino, Chair, Scientific Committee, Maria Gina Nazareth, Vice President and Overall Chair, and Shadrach Karumin, President. May I ask Dr. Dayrit to please stay on stage, please? And I'd like to call on Dr. Mario Panaligan, PSMID President, and Dr. Ella May Divinagracia Soronan, member of the PSMID Board of Council. Dr. Ella May is also one of the first trainees in infectious diseases of Dr. Thelma Tupasi in Makati Medical Center, to give the citation for Dr. Tupasi. And may I kindly ask Dr. Claver Ramos to come up the stage to accept the citation and give a few words of response.
On behalf of the PSMID membership, the PSMID Board of Council hereby honors Dr. Thelma Tupasi for her exemplary contributions to the field of infectious diseases as a distinguished physician, teacher, and researcher, and most notably in her efforts toward the control of TB, HIV, and malaria. She has served as a pioneering leader in the infectious diseases community, both nationally and internationally. Dr. Tupasi was among the founding members and presidents of the Philippine Society for Microbiology and Infectious Diseases. She also served as the director of the Research Institute for Tropical Medicine. Subsequently, she founded and led the Tropical Disease Foundation which undertook numerous landmark projects such as the 1997 and the 2007 National TB Prevalence Surveys in collaboration with the DOH. Under her leadership, TDF became the first WHO-endorsed MDR-TB treatment facility pilot project in the world. This was scaled up to our present-day nationwide network for programmatic management of drug-resistant TB, providing universal access to second-line anti-TB drug treatment, which has positioned the Philippines globally as a trailblazing training ground for person-centered MDR-TB care. In line with this, Dr. Tupasi served internationally as chair of the STOP TB Working Group for Drug-Resistant TB. With the rise of HIV complicating TB treatment in the Philippines, Dr. Tupasi successfully advocated for provision of free antiretroviral therapy following the model for universal access to quality treatment. For her lifetime work on TB, she was awarded the title of Honorary Member of the International Union Against Tuberculosis and Lung Disease. In the course of her career, Dr. Tupasi has inspired and mentored generations of infectious disease specialists and other healthcare workers. She will forever be a role model to us all. Thank you very much, Dr. Tupasi, and thank you very much